Hello everyone, Christian Brindle here. I hope this video finds you doing really well. And I wanted to take some time today and bring you an updated video presentation on explaining the differences between original Medicare with a Medicare supplement or Medigap versus going the Medicare Advantage route and kind of looking a little bit at the prices of these and kind of, what the cost differences really can be for you. So without further ado, let's just kind of jump right into that and we can kind of explain the differences between these two options, the cost differences, and the pros and cons. All right, everybody. So before we get started on this, I just want to mention that our agency, Christian Brindle Insurance Services, also known as Everything Senior Insurance, is an independent agency. We work with a myriad of different insurance companies. We're licensed in about 45 states, and we specialize in helping folks with their Medicare options. So if you are watching this and you would like a free, no obligation consultation, a review of your plan, maybe helping understand what your options are if you're turning 65, regardless of your situation, one of our licensed team members is waiting to help you and very happy to assist you in answering these questions. Our services are zero cost to you, okay? So our phone number is 801-255-5340. Again, 801-255-5340, and it's also down in the description of this video. Give us a call. We'd love to talk to you. Without further ado, let's jump in, okay? So the best way I can think about original Medicare is that it works like two pieces of a puzzle that fits together to give you medical coverage, right? You have two parts of Medicare that actually come from the government. And in order to understand your Medicare options, you first need to understand original Medicare, okay? So with original Medicare, you have Medicare Part A, and then you have what's known as Medicare Part B, okay? So let's kind of get these both on the screen here. So Medicare Part A has a $0 premium for the majority of individuals. The only reason why you'd pay a premium for Medicare Part A is if you didn't work enough over the course of your working life. You didn't pay enough into FICA taxes, Social Security, Medicare. And that number is 10 years or 40 quarters, okay? And that's the only reason why you'd pay a Medicare Part A premium. Medicare Part A covers a myriad of different things, as does Medicare Part B. Like I mentioned on the last slide, they work like two pieces of a puzzle. They do fit together to give you medical coverage. However, Medicare Part A, for the most part, covers inpatient hospitalization costs. Now, it covers some other things like hospice, home health care, but the most notable thing is it covers inpatient hospitalization. Now, it doesn't cover even your entire hospital stay, like it doesn't cover equipment, doctors, prescriptions they might give you, IVs, etc. It covers room and board. Now, Medicare Part B covers the provider's costs, equipment, charges, outpatient surgeries, outpatient doctor visits, and a myriad of different things. But the best way to think about Medicare Part A and B, in my mind, is that they work like two pieces of a puzzle that fit together to give you medical coverage. Now, Medicare Part B has a $174.70 per month premium at the time of recording this. We're actually just about to enter the Medicare annual election period, which is open enrollment. So very shortly, after this video is released, we should have new information on what the Medicare Part B premium is going up to, because it typically does go up at least a little bit, and sometimes more than a little bit, each and every year. Now, original Medicare does not cover 100% of those medical bills that Medicare covers, right? So it covers medical bills. It doesn't cover things like prescription drugs. It doesn't cover things like dental, vision, and hearing. It is black and white medical coverage, okay? Now, they cover about 80% and leave about 20% behind for you to pay. The biggest difference between Medicare and any other type of insurance that you've dealt with over the course of your working life is that Medicare doesn't have any type of maximum out-of-pocket or stop loss that you can hit, and they pay 100% of your bills, right? A lot of insurance will have like a max out-of-pocket, and the numbers can really vary on that, but once you hit your max out-of-pocket and like your responsibility and your costs associated with that plan, then the plan pays 100% of your medical bills for the rest of the year, right? Original Medicare doesn't have that. So if someone had, let's say, $100,000 in bills, and it was, that's what the Medicare charges ended up being with the fee schedule, they would be responsible for probably around $20,000 in bills, not to mention deductibles and things like that. So that's the holes that you have with original Medicare. It's that unlimited 20% out of pocket, It's the prescription drug coverage, it's the dental, it's the vision, it's the hearing. And what we're trying to do, and really what you should be trying to do as well if you're getting into Medicare, is finding a solution to fill in those holes and cover those gaps, okay? And really there are only two different ways that you can do it for the majority of individuals. Unless you have like some type of retirement plan, you have veterans benefits, TRICARE for life, or anything like that, which we do have other videos on the channel that kind of cover those kind of items. There's really only two different ways that you can go when it comes to Medicare. There's only two different types of directions you can go in existence. Advertisements and commercials and all those things, they try to make it seem like there is 10 million different kind of plans out there, but there's really not. You have what's known as Medicare supplement plans, also known as Medigaps, and then you have what's known as Medicare Advantage plans, okay? So the Medicare supplement, aka Medigap route, is the original Medicare route, okay? So it starts off with original Medicare. Original Medicare acts as your primary insurance. It covers about 80%. And then your Medigap or your supplement plan comes through behind it as a secondary and pays the 20% that Medicare leaves behind. So think about it in the sense that you're double covered. Medicare's primary, the supplement is secondary. Premiums, now this chart can really vary. It depends on what your state is at, right? It could be as low as $100 a month you might be paying for a Medigap plan. It could be as high as $250 to $300 a month, depending on your state and depending on where you're located. So that's going to vary tremendously from one area to another. And remember, that's in addition to your Medicare Part B premium. Of course, if you're in a high income bracket, you can pay more for the Medicare Part B premium, but majority of people fall into that $174.70 premium range that you see up here. Okay, and of course, it covers medical costs only. So the way to look at a Medicare supplement plan is it's going to mirror original Medicare. If Medicare pays, your Medicare supplement will pay. If Medicare does not pay on a claim, your Medicare supplement will not cover it either, because it is a copycat insurance for the most part. And so it's going to essentially mirror what Medicare does as a primary. So because of that, with a Medicare supplement, since Medicare doesn't cover prescription drug costs, like we said earlier, doesn't cover dental, vision, and hearing, you can pick up separate policies for those items, and they're going to vary in cost depending on what your needs are and depending on what state you're in. But these are just rough estimates for a lot of the states that we commonly work with folks in. And then, of course, you have pros and cons when it comes to the Medicare supplement plan. Okay, so the first thing that's a pro when it comes to the Medicare supplement plan is full medical coverage. Okay, between the two insurances, you have essentially full medical coverage. It's an 80-20 split. You have full medical coverage, if not very close to full medical coverage, depending on the Medicare supplement plan you're actually selecting. So that is a good thing. You have very low out-of-pocket responsibilities beyond your monthly premiums. So that's a good thing. There's no networks. Medicare supplements do not have networks historically. As long as the provider you're going to see accepts Medicare first, they'll also accept your supplement regardless of who the insurance company is, and that works the same in all 50 states across state lines. Nowadays, depending on your source, anywhere between 96 to 98% of medical doctors accept original Medicare. So that is a positive thing for sure, okay? And it's very portable, easy to travel with because of that no network flexibility. So that's good too. If you're a snowbird or you like to travel, you go on a lot of vacations, that's a very, very easy plan to do it with. You're not having to really be restricted to where you live. The cons of the Medicare supplement: the premiums are higher, folks. So when you go with the Medicare supplement route, not only are you paying your Medicare Part B premium, but you are paying your Medicare supplement premium. You're paying your drug plan premium, your prescription drug standalone Part D plan premium. You're paying a dental, vision, hearing plan premium if you choose to pick up one of those plans, which we highly recommend. So you're dealing with 3 to 4 different premiums, 3 to 4 different plans that all do something different. So that cost can be higher. Depending on where you're located, that cost may be anywhere between $300 to $500 a month out the door for everything per person. So that's not necessarily a low number for a lot of individuals. Not only that, with Medicare supplement plans, you have rate increases every single year. And trust me, folks, Every single company does it. There's really no way around it, unfortunately. And every single Medicare supplement company goes up in price. Now, some go up more than others. The last couple of years, a majority of insurance companies have seen a lot higher rate increases than we have in years past. That has a lot to do, I think, with the economy, inflation, everything like that. But even a small rate increase is still a rate increase. And then once you're on a Medicare supplement plan, or even if you ever need to enroll into a Medicare supplement plan when you're not new to Medicare, when you're not in your new to Medicare window, remember, when you're in your new to Medicare window, you can get on any Medicare supplement plan you want. No health questions, no underwriting. The insurance company has to accept you. That's either when you're turning 65 or when you're new to Medicare Part B if you postpone it due to working or something like that. So surrounding your Medicare entrance, your entrance to Medicare, you can get any kind of Medicare supplement plan you want without health questions. But down the road, let's say you sign up for one and it's the lowest cost plan and the rate increases are just going up and up and up and up every year for multiple years, and you try to change from that Medicare supplement plan to another one. At that point, if you are not healthy enough to pass the health questions on that company that you're trying to switch to, they do have the option to decline you or rate you up to where it wouldn't even make sense switching in the first place if you're not healthy enough. Now, that same thing is true if you're on a Medicare Advantage plan and you want to switch to a Medicare supplement plan. So the only time to guarantee acceptance is when you first get on to Medicare. So that is a downside of the Medicare supplement plans. And then, of course, Medicare supplements. This is something that's surprising to a lot of people. You do have low coverage on preventative services. So I'll give you an example. Medicare, I bet you didn't know this, does not cover a physical. It's kind of shocking, right? So Medicare, original Medicare, does not cover a physical. They will cover one in your first year. They call that your new to Medicare physical. After that, they'll never cover one again because they don't deem it to be medically necessary. Now, Medicare does cover what's known as an annual wellness visit, which is a less detailed physical. They do not check blood work. They don't check urine or anything like that, but they don't cover a traditional physical. Now, they will cover blood work and things like that if it's related to a pre-existing condition. Let's say you have diabetes and you need to have your levels checked every so often. That's tied to a pre-existing condition and that would be covered. But let's just say you're in the habit of going to get an annual physical every year, which most everybody should. Studies have proven that is very recommended. Medicare would not pay for that because they don't deem it as medically necessary. And there's other examples of that where the preventative care sometimes is just a little odd in terms of not covering things very often or not covering things at all that you do not see with the Medicare Advantage route. Now, Medicare Advantage plans, also known as Medicare Part C plans, okay? What are the pros and cons of these bad boys? Okay, so, well, first let's kind of identify what they are. So a Medicare Advantage plan is essentially when you run your Medicare through a private insurance company. The private insurance company, you can think of in a sense, is administering your benefits for Medicare. So you have that in place. So all of your claims are being ran through this insurance company. They're taking on all the responsibility of paying your claims instead of Medicare. So Medicare doesn't have to pay any of those claims anymore. In addition to that, you still have to have your Medicare Part A and B active, which includes paying your Medicare Part B premium to Medicare. So they get that premium, plus they don't have to deal with any of your claims, right? That takes a big burden off of Medicare's shoulders. So in exchange, Medicare agrees to fund the insurance companies every month to take care of you. And they get quite a bit of funding. And because of this, Medicare Advantage plan premiums are typically very low. We always say anywhere between $0 to $40 a month, but a majority of areas have a lot of really good viable options these days that are $0 per month. So if you did pick up hypothetically a $0 per month Medicare Advantage plan, you'd be paying your Medicare Part B premium, and that is it in that scenario. Okay, so that's just a little bit about Medicare Advantage plans, okay? Now let's go over the pros and the cons of these, right? So for one, it's simple. It's very simple coverage that you might already be familiar with. Why? Because Advantage plans do not just include your medical benefits, but you have your Medicare prescription drug coverage built into it. You don't have to pick up a separate prescription plan like you do with the Medicare supplement plan. You also have other ancillary benefits built into it, like dental, vision, hearing. It's very common that a lot of Medicare Advantage plans come with pre-built dental, vision, and hearing coverage. In addition to that, you have other benefits that we'll come to in a second here, but it is very simple. You have one plan for everything, one card that you use for everything, and you don't have 3 to 4 different plans that all have a different job. Lower premiums, which we've identified, right? It saves you on that monthly cost, especially if you don't use your insurance very much. Variety of additional benefits built into the plan, as I mentioned, such as dental, vision, and hearing, and quarterly over-the-counter item allowances, gym memberships, and a myriad of other things can be included with certain Medicare Advantage plans. What are the cons of Medicare Advantage, right? They do have networks, whereas Medicare supplements do not. Now, this can be a bigger problem with some Medicare Advantage plans than others. Some plans have great big networks where they give you all different types of choices, and you have all these different places you can go to, and it's not as much of an issue. Some plans have national networks in all 50 states. Other plans have itsy-bitsy tiny networks where you just don't have a lot of choices on where you can go. So the networks are a con, even though it's not as big of an issue as it used to be. Copays. So on the medical side with Medicare Advantage plans, you do have copays. And these copays can add up with frequent doctor visits or if you're hospitalized regularly. Now that being said, I have always said that the majority of Medicare Advantage plans are better than most under 65 health insurance plans. Because while you have copays, you typically only have copays and you do not have deductibles. Okay, so usually the only cost you're associated with on most Medicare Advantage plans is, let's say you go to a primary care doctor, you might be looking at $0 to $5 copay for that. If you have a specialist copay, you might be looking at $10, $20, $30, $40, $50, depending on your area, copay for that. If you go to the emergency room, you might be looking at $100 to $125 copay for that. If you spend the night in the hospital, you might be looking at $200, $300, $400 per night for the entire hospitalization visit, all in one claim. And then they have maximum out of pocket. So the medical coverage is still very good. We can look at those specific benefits for you if you like in your specific area, but you do have copays and they can add up, and you don't typically have those as much, if at all, on the Medicare supplement side. So to kind of give you a little bit of a summary, right, this is the side-by-side breakdown of Medicare supplements versus Medicare Advantage plans. So which one is more affordable? Which one's more economical? The answer comes down to two conditions, right? Two variables that depends on you. Number one, where are you located at, right? Because some states have these really high Medicare supplement premiums and really strong Medicare Advantage benefits. So where you're at is going to have a lot to do with it. In most states, you're probably looking at, I said, depending on the state you're in and the market you're in, if you pick up a dental, vision, hearing plan, which we highly recommend, you're looking at anywhere between $300 to $500 a month per person in premiums, okay? Whereas with the Medicare Advantage plan, you're looking at $175 basically if you pick up a $0 premium plan. Okay, so premium-wise, the Medicare Advantage plans are more economical, but the second variable has everything to do with your usage. How much are you using your plan? Are you using it enough and frequently enough where the copays that you'd incur on a Medicare Advantage plan would be greater than the monthly premiums you'd pay on the Medicare supplements? If that is the case, and if you have any real chronic issues, the Medicare supplement is probably the way to go for you. The other thing to keep in mind, there are some areas where Medicare Advantage plans are very strong and Medicare supplements are fairly expensive, that the Medicare supplement premium might be greater in a year, in an annual basis, than the maximum out of pocket. I actually saw this case just like this the other day. Someone's annual premium on a Medicare supplement in an area would have been probably $3,000 to $3,500 a year. That was the annual premium they pay for the prescription plan, the med sup, etc. Whereas the maximum out of pocket on the Medicare Advantage plan was only $2,500. So remember, once you reach your max out of pocket on the Advantage plan, you have full medical coverage for the rest of the year. So in that scenario, what was more economical? Probably the Medicare Advantage plan, because the premium alone would be greater than the max out of pocket. But that's not always the case. So it has everything to do with where you live and how much you're going to be using your plan. And that's why it is very important to take a look at this individually, not take any previous biases you might have heard on either side of the coin on this, and really look at it based on your needs and your preferences and making the best decision. And that's what we specialize in here at CBIS and Everything Senior Insurance, okay? I hope you found this video helpful. I hope it gave you a much better understanding of the breakdown of the cost differences between these two different options. Again, we work with both. We are very proficient at both. and there's no cost or obligation for a free consultation with one of our amazing team members. So give us a call today. Like I said, our number is down in the description of this video. We're licensed in over 45 states, so chances are we can help you where you live. And if you like this video and you want to see more like it, please do us a favor. Smash the like button on this video for the YouTube algorithm. It helps so many more people on Medicare who are struggling, understanding their options, find this video easier. You can really help somebody out today by doing that. Subscribe for more future Medicare content. We really appreciate that. And make sure to comment your thoughts down below, any questions that maybe we did not have a chance to get to in this video. Thanks, everybody. We'll see you on the next one, and happy Medicaring.